I'm not sure if every teacher will do this, but you are going to have to make flashcards as a grade for this. I'd rather go through military basic 50 million times than to go to nursing school ever again. Especially if that is the wrong dosage for the patient and something were to happen to the patient, you will be the one getting in trouble, not the pharmacist, not the doctor. Hey guys, it's Zoe and welcome back to Zoe Alliance. We are breaking down term 6 of ECPI's ADN program, which includes nurse 138 pharmacology and nurse 119 dosage calculations. I'll explain what you learn, what makes the term challenging, and how to survive med math in the ECPI's program. Also, before we get into today's video, congratulations on making it to term 6. You don't have that much further to go. It's been a journey. Nursing school is very mentally exhausting and even physically exhausting if you already have a full-time job, you're in school full-time, just that work-life balance. Been there, done that, wouldn't wish it on my worst enemy. I'd rather go through military basic 50 million times than to go to nursing school ever again, especially an accelerated one. It's not for the weak. It's not for the wounded. Is that how they say that? The weak and wounded. Also, can you just admire how my hair looks today? Like, the last time I had my hair down in the video was probably 8 months ago. Because when it's raining in Charleston, I can never have a good hair day. But I rebuke it this year. You're going to be having popping curls every single video. I will not let the Charleston community destroy my good hair. Okay? Look at this, like, yes. I love it. Love it. Anyway, there's also something else I'm gonna say. Oh, before we even get into this video, just go ahead and like, comment, and subscribe. Comment a stethoscope emoji if you are new. I don't know. Wait. What did I want you guys to comment if you're new? If you're first time viewing. If you are new, comment a waving hand emoji. If you guys are new to this channel, subscribe before we get started. Just go ahead, just stop the video. Go ahead and subscribe. I already know that you're gonna like this channel. You do all types of things over here. Lifestyle videos, so baking, cooking, reaction videos to our old humor cells, career videos, military nursing. Amaya's in school for paramedic school. She's in school to be a paramedic. So maybe when she's done with that and she has a little bit of time, she go over stuff like that for you guys. It's always a good time. You just filmed another video for my military people last week. So go ahead and check that out. So pharmacology ECPI is where medication officially take over your body. So you'll learn medication classifications, mechanisms of actions, side effects and adverse reactions, nurse considerations, and patient safety. This is where you really start seeing how medications affect different body systems and how everything ties back to anatomy and physiology. My biggest tip is to create flashcards during this class. I'm not sure if every teacher will do this, but you are going to have to make flashcards as a grade for this. Make extra ones if that helps with your learning skills, make Quizlets. So on the flashcards, we did like side effects, contraindications, nursing interventions, and the usage for that drug. It was very difficult. I still have my binder full of the drugs that she made us take notes on and that we can turn in for a grade. It's a lot to. I'm willing to do it. If you guys want me to email you guys those things, I feel like y'all won't need me to email it. I mean, you still have to write it and hand it in. So either way, you have to write it. It's like a matter of, do you want to look it up or do you want me to provide them for you? And you may or may not have the same drugs that I got. From what I remember, I'm pretty sure that my teacher divided into categories. Like I'm pretty sure we learned like hypertension medicines. We were learning mental health drugs and mental health. So we didn't learn any of those. You learned like medications for like different diseases like hypertension, hypothyroidism, Parkinson's, all of the things. I'm pretty sure they were broken into categories. It's overwhelming in this class, I'm not gonna lie, just because there's so many medications, especially when it comes to blood pressure meds. So there's different categories and you can learn the ending and suffixes and all that stuff. It's a lot. I'm not gonna lie. Mentally prepare yourself. If you guys want me to email you this stuff, just comment down below the stethoscope emoji, like always, during the routine. Comment the stethoscope emoji. Me and Amaya's email. I'll put it here. But still leave a comment so that way I know to check my email because I don't get notifications from my email for some reason. So just comment that you emailed me. I will check my email and send you the pharmacology notes that I have. So as for dosage and calculations, this is the most critical class for patient care and patient safety because if you already work in like a hospital setting or nursing home, granted you aren't the one doing the calculations. You're like, why do I need this class? I'm not the one who handles that stuff. The doctor does. But the doctor does it, and then they put the order in, which goes to the pharmacist, and then once it's approved by the pharmacist, it goes to you to give to the patient. You pull from your medication box, your Pyxis, whatever you got, call it. But if that is the wrong dosage for the patient and something were to happen to the patient, you will be the one getting in trouble, not the pharmacist, not the doctor. You. So this is why this class is important, because if you didn't know the basics of how to calculate the proper dosage for a patient, you wouldn't know when to catch, oh, I don't think this is right for the patient. Maybe we should do this and tell the doctor about it. You wouldn't be able to vocalize that to the doctor. Does that make sense? So just make sure you're paying attention to this class because it's very important. Okay, it's very hard, but it's doable. So enough of the rants. Let's get into what you're learning. So in the class, you're learning about conversions, ratios, and portions, along with oral and IV medication calculations. Accuracy really matters here, not only for, outside like the clinical aspect and why you want it to be accurate for patient safety, but as for like testing and stuff, like one small mistake can really mess up your problems. So make sure that you are constantly practicing the dosage questions. Use a whiteboard, whatever helps you best to study. Make sure you are using that and do it, rinse, repeat, rinse, repeat, rinse, repeat. If you still don't get it, watch the YouTube video. For me, this class was very, very intense because I felt so overwhelmed. I think this is one of the classes I felt really, really overwhelmed with because it's a lot to remember and a lot to grasp. If you took chemistry or anything like that, it's kind of similar to that, except without all the charts and all that. Like, it's very similar to chemistry, if that makes sense, when it comes to like conversions, and it's not fun at all. So something that helped me was I would use my whiteboard. My teacher gave us like a little conversion chart, and I would rewrite the chart over and over again until I had it memorized. And for every test, from I think I started doing it term 3 until like the rest of my program, I would always ask for a blank sheet of paper. Especially with this class, I would make sure I would write down the whole dosage chart before beginning my test, just in case I have test anxiety. And I would just like reference the chart. So I had it right there. Visual learners that helped me. I don't know about you guys, but that's what helps me. Also, another side tangent, I also did like this class, even though it was stressful because we had the same teacher through Constant Summers 1 all the way until I think this class right here. This was the last time that we had her this class. So term 6 was the last time. We got to experience her IVF journey and then her getting pregnant. We also threw her a baby shower, which was really, really cool and awesome. So she helped us a lot they're just scams. Like I wish they would do that more often. Like having the same teacher throughout certain classes, because that actually helps with building a relationship and focus, and you're already used to like their teaching style and their testing style. So that also really did help with the program. Maybe they'll start doing that, because I highly suggest ECPI. Y'all should be having the same teachers for a lot of these classes. Okay, because having a new teacher every term is very, very, it's not it. It's not, because some of the teachers don't care. You can tell. So hopefully you guys don't have to experience that. I've experienced that like maybe 1 to 3 times, but the teacher doesn't care, including the clinical instructors. So a little recap for my skippers out there. Pharmacology is about understanding drugs and how they affect the body. Dosage and calculations requires your repetition, accuracy, and confidence for patient safety. Oh my gosh. So daily practice is the key to surviving terms. More so than ever, because it's hard to grasp. Like, you have to know your problem. It's math, okay? You can't fake it with math. You can't guess with math. You will need to type in the answer. Like, and it's not multiple choice. Not that I remember. I don't think any of our tests were multiple choice when it came to doses. So you really got to know your stuff. You can't forget a symptom. Pay attention, pay attention, pay attention. Alright guys, that wraps up today's video. Congratulations again. I will see you guys in term 7. Comment a stethoscope emoji or a pill emoji if you want me to send you some of my pharmacology like flashcards, because it's like on a piece of paper. Like, it's a lot of information. So I was like, it'll be a lot to take a picture of. It's a lot of medications. Like, I have a whole binder full of medications. That's how much stuff we had to write down every week. It was crazy. It was ridiculous. Buckle up. It's gonna be a crazy ride. But I'm willing to do it for you guys. So just comment the stethoscope emoji or pill emoji, and I will get those notes to you by email. So just comment down below. I will send you my email. And then you can write me or whatever. I'll check the email, send you the notes. Usually I respond in like a day or 2. Just depends. That's why commenting is important, because I won't know that you emailed me unless you comment that you emailed me, because I don't get my email notifications. So yeah, I know we're in a different setting. I'm trying to switch up the settings a little bit. Last time I was in the car. Today we're in the bed. Not because I'm lazy, guys. Just switching up the setting, you know. So yeah, don't shoot. Yeah, that's all I want to tell you guys. Hope this video is under 10 minutes, because that's how they're supposed to be. Less than 10 minutes, and then if you have specific questions about the terms, comment them down below. And I'll see you guys in term 7. Let me know how term 6 has gone for you guys on term 7 video. If you haven't watched term 5, or if you're just, yeah, I don't know, what would you watch in term 6 for term 5 during program? Yeah, if you ever want to watch term 5, watch that if you haven't already been through term 5. And yeah, watch some of our other videos. I'll put a little card or at the end screen. Watch some of our other videos. They're pretty good. They're alright. Also, I don't get paid for these freaking videos. I just make them. Like, I know I'm at 1,000 subscribers, but also, if you didn't know, you have to have a certain amount of watch hours, and our watch hours aren't there to get monetized. So if you guys just want to support to make sure we get to 4,000 watch hours, go ahead and watch our other videos, binge watch them, so you can boost our video watch hours and get paid. Thanks, bye.
Wake up for you, only know like once. Life move fast when you do what you want. At this time, doing what I want.